Hi everyone, this is Jason. Welcome to our another video. And today's topic is very different from what we generally do. It is very different, in fact. And this is the first time I'm going to discuss something other than nursing, which is generally my forte. Today we're going to discuss how to become a pharmacist in Australia. And the reason why I thought this would be a good topic is that uh, many of the other paramedical professionals have messaged me asking, can you please let us know what is the procedure for becoming a pharmacist, dentist, technician? So I thought, let me have an expert discuss all these with you today to start with how to become a pharmacist in Australia. So today we have Dr. Akram Ahmed. I'm sure you must have seen a previous video of me and Dr. Akram on his channel, wherein he invited me to discuss about how to become a registered nurse. And Dr. Akram Ahmed is a very renowned pharmacy professional in Australia, and he has completed his PhD from University of Sydney and has been an academician from last 10 years and has been, has worked in various different countries, India, Malaysia, and Australia. Apart from this, he's the founder and CEO of Academically. Academically is a very reputed institution which helps overseas pharmacists as well as technicians and dentists to convert their registration and to start their careers in Australia. So without further ado, I welcome you once again, Dr. Akram. Thank you so much for giving your valuable time to us today.
Thank you, Justin, for your time and to inviting me. And yes, we can start, a lot of questions.
Yes,
Yeah.
absolutely. So, we'll try to make it in, converse in English and Hindi mixed. I'll try my best to speak in Hindi.
Yeah. No problem. Yeah.
Okay. So, Dr. Akram, the first question is like, I have the most, mainly my audience is those who are, watching from India and Nepal. So, what are the steps for to become a pharmacist in Australia for someone who has studied their B Pharm in India or Nepal and whose qualification is not considered to be equivalent as per Australian standards?
So basically, in Australia, the minimum requirement to become a pharmacist, you must have a 4-year bachelor degree. So basically, in India nowadays, you can see like B.Pharm, there's a degree, and another degree called Doctor of Pharmacy. So these two degree, most of the pharmacy college nowadays they are offering. So if you come to your B.Pharm or PharmD, M.Pharm, so you are eligible to work in India. But if you did the diploma in pharmacy, so you are not eligible. Diploma or degree minimum you need. So basically, degree plus you must register as a pharmacist in your home country. This is the requirement, and there is no need to have any work experience for pharmacists. And so there is a 3 step you need to complete. I can say it's not three, it's like just 2 steps. First is the skill assessment. There's Australian Pharmacy Council. You have to do your document check. Basically, they will see your 4 documents. Basically, you need your degree, your transcript, and your passport, and your registration as a pharmacist in your home country. So for this first step, and then second step, you have to write this CAPS exam. CAPS exam is an online exam. There is so many centers in India, so you can write. Even in Nepal, there is no center, but Nepalese student can come to India to write the exam.
Okay, perfect. And then what happens once the student has passed the CAPS exam? What is the further step?
Particularly once they pass the CAPS exam, then they will receive one letter. It's called a skill assessment letter. So based in this letter, they can file their visa. Basically, they have to file their EOI, expression of interest for their visa. They want 190 or 491. Maybe that you can discuss with your migration lawyer or something. But generally, you can file your EOI for permanent visa 190 and 491. But there is some other visa also you are eligible, basically like work visa 482, 494 regional work visa, another visa called 407 also training visa also eligible for pharmacists.
Okay. So once they get the visa, they come here. Can they immediately start working as a pharmacist, or they have to undergo an internship or supervised practice before they start their practice?
So basically, I forgot one step. English mandatory because it's not just for pharmacists.
Yeah.
When you are a nurse or medical doctor, dentist, so English requirement for everyone is the same band individual. So same for pharmacist also, you need to be have this, So once you completed the CAPS exam and come to Australia, you can work directly as a pharmacy intern. The pharmacy intern means you have to work 12 months under a supervision of a senior pharmacist. So in that, in this 12 months, another exam you need to pass is called oral exam.
Okay.
And then you can become a registered pharmacist in Australia.
Okay. So is the supervised practice period, is it paid or unpaid generally for people?
Yes, this question so many students ask me always. So basically, this is not a intern. I can just give the name of intern, but basically it is a job for you. So you will getting paid at about $30 to $35 per hour.
Yeah.
And I can, if I convert it into a yearly, maybe around 65 to 60 to 70,000 per year. In your first job, you can earn as a pharmacist.
Okay, that's great. And how many, what is the duration for the supervised practice before they're eligible to sit for the oral examination?
Yeah, so basically, this is basically a 12-month internship, but generally they said that at least 60% supervised training you have to complete. So at least you can do like 7-8 months you completed your internship, then you can go for oral exam. So we also provide the coaching for oral exam as well.
Okay. Okay, so to kind of summarize the steps, correct me if I'm wrong. So first is the skill assessment, like any other professional, they have to apply, complete their skill assessment. It's an online application system. And once they get their outcome, they have to prepare and appear for the CAPS examination. They can do that in their home country, provided they have a Pearson VUE center around where they live. And once they pass that CAPS examination, they'll have to look for the options to come to Australia, to basically migrate to Australia on a particular visa, which of course they can discuss with reputed migration agents. Once they are here, they need to work under supervision of a senior pharmacist, which is called an internship or a supervised practice. This is a paid internship. And once they complete the 60% of their supervised practice period, they are then eligible to appear for the oral examination. And once they pass the oral exam, they get their license.
Yes, exactly. Yeah.
Okay. And also just to add that, which stage is the IELTS required? Is it before their CAPS or after their CAPS?
Basically, there is no fixed rule, but generally you need after the CAPS exam. But many students do before, because when you give this CAPS exam, you will get the result. So same day you can apply for your visa, Otherwise, if you want to write the CAPS, the English test after the CAPS, then it may take like 1 or 2 months for you, then it will be a little bit delay for you. But generally it needs after the CAPS, not before.
Okay, understand. Okay. And also, I think many students message me asking, is there a validity for the CAPS exam? Does it expire?
Yeah, generally CAPS exam is 3-year validity. Basically, the skill assessment is like unlimited.
Yeah.
Once you've done the skill assessment, but for CAPS exam is 3 years. So 3 years is not met means that it's going to be expired. Means that within 3 years you have to migrate to Australia.
Okay, understand. And what about the oral examination? Is it conducted across Australia or any particular city? It's a one-day exam. Like, how does that work?
Basically, when the student is coming to Australia and they are starting their internship, so at the same time, they also need to enroll one of the course. The course provided by a Guild of Australia, and there are some universities. For example, in Sydney, University of Sydney, and there's a Monash University. So there are so many universities. They provide those courses, and you have to enroll one of your nearest university. And after that, basically, this oral exam is nothing is very easy. Just a OSCE exam, basically same like nursing or maybe medical. That's a similar thing.
Okay. Okay, that's helpful. Now, in terms of the average salary for pharmacists, again, is a very common. Thank you for letting us know that the internship is paid and they earn a decent amount of salary. So what is the kind of salary for somebody who completed his or her registration as a pharmacist, now is hitting the pharmacy in the first year of their career?
So basically, as a pharmacist, the main salary, basically, most of the pharmacists need to work in retail pharmacies or maybe in the hospital. So mostly if you are working in hospital pharmacy, government hospitals, so salary is a little bit different. But in general, 95% your chance to get your first job in retail pharmacy, and later on you can go in hospitals. In retail pharmacy, the salary is around $40 per hour, like newly registered pharmacist. But it can be like $50 up to $60 per hour after a few years of experience.
Okay, that's very helpful, Dr. Akram. Now, the other question is, I'm sure, like, disclaimer here, we both are not registered migration agents, but what we can talk about migration is from our experience of dealing with multiple students, and same is what with Dr. Akram. So, Dr. Akram, in your experience, or how difficult it is to get the visa sponsorship, or
actually, this is the main point. This one always ask. That's can we pass, once we pass the exam, can we get the visa, and do we need a sponsorship for this visa for pharmacists? So generally for 190 or 400 visa, no need to any sponsorship, because the state itself is sponsoring you. Know. But you need a sponsor if you are looking to migrate Australia as a work visa. For example, 482 visa or 494 visa or 407 visa. So these three visas need a sponsorship. These two visa, permanent visa, does not need this sponsorship. So it's very easily nowadays. For example, Western Australia, our so many students, they passed in November. Almost all of them, they got invitation from Western Australia. One student got within 3 days, another like 20 days or something. So hardly nowadays, basically, I can say like in healthcare professionals, the good opportunity, because the visa they are given very short, even for nurses, pharmacists, medical doctors.
No, I agree on that. It's it's the best time to be a medical professional in Australia.
Yes, बहुत सारे engineers हैं ना, if you are comparing with engineers and some other professions, so the healthcare professionals have an advantage right now. I can say 2023 can be a dream year for you if you want to migrate to Australia, so you can start to play it.
Right. Absolutely. Okay. Now, the other thing is that in terms of the cost, so somebody who's looking at our, maybe watching our video today, what is the kind of cost in the whole procedure that they need to prepare, the budget? Of course, I'm not going to talk about the migration fees or the government fees or the application examination fees is involved.
So basically, we are not talking about the visa fees. You have to discuss later on with the migration agent.
Absolutely.
But apart from this, there's a two-step, as I told you, skill assessment, then CAPS exam. We also include like English exam. You also need to go for IELTS or PT, whatever. So all together, so first step, you need to pay 1310 skill assessment, this fee, and it may take up to 4 to 6 weeks. Generally, they take. But they say that up to 8 weeks it may take, So 1310 AUD, and then you need to pay the exam fees at 2190. Then you want to give, for example, next exam is going to be in March, then another exam in July, then November. There are three times the exam in the yearly they conducted. So total basically 3,500 AUD you need to pay to the Australian Pharmacy Council. And maybe we can say $200, $300 maybe for English test, like IELTS or PT separately.
Okay. And is there any additional fees for the oral examination once they have come to Australia?
Yeah, that's separately. Basically, at the time they are earning. So I'm not basically. I always tell to the student, you just focus to the CAP and pass the CAP and come to Australia.
Right.
And you are already got the job. You are working. Then you completed like 60-70% your internship. Then only you need to go for oral exam. So oral exam is nothing but still we can say it's like around $1,500 to $2,000 AUD or something like that. But you are earning at that time, so for you, I think if you are spending, it might be not that much problem.
Right, you're in a different zone. You're not in that initial stage. You've earned and saved up money to,
Now initially maybe you have to pay your savings. You have to maybe your parents and your savings.
Right.
But once you are in Australia, so you can save and you can do yourself.
Okay. Okay, great. Now, I think we have summarized kind of, the whole steps, and this is supposed to be an introduction video. Now, another question that I had was that how does academically support the whole journey? So what kind of services do you offer, your team offers in terms of the whole journey for, to become a pharmacist in Australia?
Basically, we A to Z services we provide for pharmacists, like skill assessment, for CAPS exam preparation. CAPS exam preparation we give not just for 2 months or 3 months. It is like until you pass the exam. So whether it is take to you 5 months, it take to you one year, 8 months, doesn't matter. We will guide you in each step if you need, And then English also we provide for you, that PT coaching from Australia. So basically, we will help you to complete all these steps. And if you need a lawyer, so we can connect with you, some migration lawyer. Otherwise, you can file yourself. It's up to you.
Okay, understand. So basically, those who are listening, if you're a registered pharmacist in your home country and you're looking to migrate to Australia and start your pharmacy career, Academically offers A to Z support, all support that you need for each of your steps until you become a registered pharmacist in Australia. Okay. Of course, migration services are separate, but Dr. Akram can assist you with that in terms of getting you connected to the right people who know this field and who are trustworthy in their profession. Okay, perfect. Dr. Akram, last question. Do you have any advice for those who are thinking about it, sitting on the fence, wondering, whether we should go to Australia, whether we should go to Canada, in that dilemma of what we should do?
Basically, I have 5 students in my previous batch. They were planning to go to Canada and they invest a lot of money. They invest like up to 1.5 to 2 years. And in Canada nowadays, they are not given any visa and the exam is very, very tough. So the passing marks for CAS is just a 50%. Out of 100, you just need to 50 correct answer, and there is no negative marking in Australia. When we are comparing with Australia, 60% passing mark, and I can say 30% extra syllabus. So most of the students, even they pass. I have 2 students basically right now with us. They are right now in Canada. So they went from India. Even one guy was on PR, so he's planning to take another PR in Australia. Another student, she went for the study, master degree there. She only spent like 30 to 40 lakh rupees, and now she's planning. She's saying that the weather is not favorable in Canada. And another important, she's saying that the job opportunities is that much is not available. Sometimes they are given like 12 hour, 15-hour weekly. You are not getting the enough hours to work as if. Yes, so a lot of problems in Canada. You can do your own research, but my advice, Australia is best for you because they are giving you the visa. So this exam you can pass from your home country. Directly you can file your visa and you can come to Australia with your family. And please do not, बहुत सारे लोग क्या करते हैं, सोचते रहते हैं, तो प्लीज आपको एक्ट करो. ऑस्ट्रेलिया आना है तो ठीक है, नहीं आपको कनाडा जाना है तो कनाडा का ही ट्राई करो. मतलब हमारे पास लोग मिडिल ईस्ट में जो इंडिया से हैं और जो मिडिल ईस्ट में जॉब कर रहे हैं, वो लोग सोचते रहते हैं आप किसी के जो भैया 45 प्लस कोई 48 50 ईयर अब उनको आना है ना, तो ऐसा सोचना नहीं है. आपको ऑस्ट्रेलिया बहुत ही अच्छी जगह है. कनाडा जाना कनाडा चले जाइए, यूरोप के जाए, जहां जाना चाहे वहां जाइए और एक्शन कीजिए, मतलब अपना एक्ट कीजिए. मतलब अपने कंफर्ट जोन से थोड़ा बाहर आइए, तभी कुछ आगे बढ़ेगी कहानी. अदरवाइज बहुत ही मुश्किल है यहाँ आना.
No, I agree on that. And मेरे पास हमेशा ऐसे questions आते हैं, कहाँ जाए, कनाडा जाए, ऑस्ट्रेलिया आए, यूके जाए. So I was like, go wherever your heart goes, that's fine. But कहीं तो जाइए जरूर, take that step.
हाँ, मतलब और जल्दी स्टेप लो आप. मतलब सोचते, मतलब आपने 2 साल आप इसी में लगा दिया आपने कि मैं कहाँ जाऊँ कहाँ जाऊँ. 2 साल में तो आप कहीं भी जा सकते थे ना. तो आप ऐसे सोचो और जल्दी एक्शन लो.
Yeah, and the rules and regulations also change very frequently. So अभी अगर conducive environment है pharmacist के लिए ऑस्ट्रेलिया में, तो वो opportunity utilize करें और जल्द ही उसके towards work करें. डॉक्टर अकरम अहमद से कांटेक्ट करें. डॉक्टर अकरम का एक बहुत ही पॉपुलर यूट्यूब चैनल भी है. आई विल पुट द लिंक ऑफ हिज यूट्यूब चैनल, वेबसाइट and his social media handles in the description of this video so that they can get connected with you. And I'll also put Dr. Akram's contact number for any more information. Okay, so thank you so much, Dr. Akram. Any other
Thank you so
thing?
much. Yeah, I think that's all. I think you could cover all the questions.
Oh,
Yeah.
okay, perfect. Dr. Akram, thank you so much. Thank you for giving your valuable time on a holiday, especially, and
Yes.
very glad to have you. I'm sure that we'll do many more videos ahead.
Yes, sure. Thank you so much.